You want the best knees in 2025? Imagine moving without limitation, running faster, jumping higher, and living pain-free no matter your age. In this video, we're going to show you how to unlock your knee's full potential with cutting-edge exercises, recovery tips, and expert strategies on how to build strength, flexibility, and durability. I'm Dr. Tammy Penhollow of Precision Regenerative Medicine. Your best knees are just a few steps away. Subscribe now and let's build the knees that will carry you into a pain-free, active future. When we look at knee pain, we want to address you as a whole body, a whole person. So I'm not just going to have one thing that says, oh, my best knees forever today. No, we've got to look at things from the inside out because we're going to heal you from the inside out. We're going to talk about the baseline. We're going to get some labs. I want to know your inflammatory markers. We have high sensitivity C-reactive protein. We have ESR, erythrosedimentation rate. It's better to just say ESR. I want to know what your baseline platelets are, what your baseline blood count is, because ultimately that lets me know what we've got going on when we want to use your own cells. So we're going to get labs. We're going to have some imaging. I want standing films. When you're laying flat on a table, your legs can be like this, but that's not how you live. You don't typically have knee pain at rest or just laying flat. Most people have knee pain when they're standing. So we want weighted standing knee films. We want from the front to the back. We want from the back to the front with a little bit of a bend. We want from the side, and we want what's called the sunrise view, which shows me the patella, because there are 3 different compartments of the knee, and each of those compartments can have things going wrong, either acutely, like an injury, you've strained a ligament, you've torn a meniscus, or chronically. Oftentimes people come with wear and tear that's not level. We have more likely to have more medial or inside knee wear and tear or arthritis. So you can see that because the arthritis may only be on this inside or medial component of the knee. Conversely, we can have some lateral wear and tear, or there can be the compartment here between the patella and the femur. So those films are important. May need to get an MRI because advanced imaging can show things like bruising or bone marrow edema in either the femur or the tibia. Can also look better at soft tissues, things like a meniscus, things like a collateral ligament, particularly the anterior cruciate ligament, the posterior cruciate ligament. Those are challenging to see on ultrasound. Those are not seen on plain films. So that's an important one to have an MRI for. And MRI can often diagnose a meniscus tear a little bit better if we're talking about at the root or one that's extruded. We do a physical examination and an ultrasound exam. So all this is about the actual structure of the knee. That's important. So we're talking about labs, we're talking about imaging. There's also a history and physical exam. We want to know, did you just injure it? So if you want your best knee in 2025, we want to know if we need to start from something acute, like let's rest it. Let's put some ice on it because that's going to reduce some inflammation. If it's not an acute injury, maybe it's a chronic thing like arthritis. We're going to put some heat on it. Why heat? It actually makes the muscles warmer, rushes blood flow to that. The muscles are more supple. The joint gets warmth. If you've not noticed, maybe your arthritis is worse in the morning, very stiff. And then as you move along during the day, it gets a little bit easier to move unless you overdo it. And then it gets painful again, might even get swollen. That's when you might then put the ice on it to reduce the swelling. But really, we want to get to the bottom of things. So all those things kind of help me determine where the knee pain is coming from, the physical exam, the imaging, know what's underlying in your body with your baseline blood tests. Then we want to know really what is fueling this inflammation. You got to look at diet. We want to know what you are eating in what proportions, how much of the inflammatory foods. We're talking processed foods, sugar foods, alcohol, Some people say red meat. That's very controversial. We've got some videos that specifically address that, particularly the session with Carrie Camp, who is a health coach. So we want to know what you're eating. We want to pull back on those things that are inflammatory. We want to eat the things that are not inflammatory or very anti-inflammatory. Those are things like avocados and blueberries and sweet potatoes, and replacing white rice with brown rice, white bread with whole wheat bread. Some people need to reduce or eliminate lactose if they're lactose intolerant, because any amount of lactose keeps spinning up the inflammation, and that can even just be within the gut. So the microbiome is important. So your diet is super important. We also want to look at the other holistic things. How much sleep are you getting? We need rest. We repair at night. So if we're not getting good quality sleep, if you have sleep apnea, we need to treat sleep apnea, because if your body is waking you up 400 times a night so that you don't stop breathing, so that your oxygen doesn't go too low, it can never get in that rest and restore phase. So treating sleep apnea, getting good sleep, having good sleep hygiene, which is things like maybe having an hour before bedtime where there's zero screen time. That means TV, that means phone, that means Kindle, that means iPad, all those things, so that you can actually get into that restorative phase. Having good sleep hygiene, such as not having anything in the bedroom other than sleeping, not eating, not watching TV, not playing on your phone. The bedroom is for sleep. Also look at stress relief. Do you do something that is for you, whether that be meditation, journaling, yoga, going to the gym, working out, spending time with friends, having some form of a social life? Those are all things that help reduce stress. Then we can move into, are there things I can take, supplemental kind of things? Sure. We have specific videos on that. I'm a proponent of some very specific nutritive supplements if you've got a deficit. So we may want to know, what is your vitamin D level, for example. We want to know if you're getting the kind of vitamin D that you need to. And even living in the Arizona sun, a lot of people are vitamin D deficient. Vitamin D is super important for helping build and maintain bone. And we'll talk about that when we talk about joint stabilization in just a second. Another supplement is to consider a very good quality probiotic. And that comes back to the nutraceuticals and the microbiome, so that you can actually have from the inside, the gut is working and it's actually helping you metabolize all of those foods that you're eating. Hopefully it's then put to where it needs to go. Then we'll talk about the next thing, stabilization, strengthening, and stretching. So many specific, great building muscle and stretching muscle and ligament videos in the channel. So please go back to those for some specifics. I've got some of those, but we want to talk about having a strong joint, a strong stabilized joint. Well, what's on the outside of this? We've got muscles. And what I find most frequently when I examine people is that the inside muscles, or the vastus medialis of the quad, is not as strong. It's actually atrophied. And that comes even with an osteoarthritis. So imagine you already have a weakened muscle here. You've got stronger muscles here. Every step, then this one is probably putting some pressure on that medial aspect. We also identify that not just with looking at the muscles, but we watch you walk. If you're walking in a form, most people have more of a valgus deformity, where here is the hip, here is the knee, here is the ankle. So we're putting more stress. There's angle here, puts more stress, wear and tear on that medial aspect of the knee. Less common to have a bow-legged, where the hips move here to the knees and then move into the ankles, but that can then wear and tear on the lateral aspect. So we need to balance the muscles. You can do that at the gym. There's some very specific quadricep strengthening. You don't just want to look at the quads though. We want to look at the glutes, particularly the glute medius and the glute minimus, because they are responsible for rotating the hip and abducting the hip. If that is not strong and it gets weak from sitting, we're sitting all day, then you're going to have more wear and tear all the way down and get knee pain from the glutes. So very specific strengthening and stretching exercises for that. Another thing to look at is not just the hips, but at the ankles. If you've got weakening at the ankles, or you've had some repairs at the ankles, particularly a fusion or plates and screws from a prior fracture or an ankle replacement, then that can translate all the way up to the knees. So looking at strengthening, stabilizing, and flexibility stretches. We also use the EmSculpt machine. Can use the EmSculpt on the quads, and I tend to kind of move that in towards the medial aspect of the quads, because what is atrophied and wasted? Vastus medialis. It's the equivalent of doing 20,000 squats in one 30-minute session, and that can jumpstart some people. When we do look at stabilization, it's not only strengthening the muscles. Sometimes we need to gap the joint for a period of time. If you have more medial arthritis, or you have a medial collateral ligament strain, or you have a medial meniscus tear, if you continue to walk the way you're walking, unbraced and not unloaded, then you will continue just to put more pressure down on that medial aspect. It needs some time to repair. We can do things like KT taping, where we very strategically unload the medial aspect and keep that knee in better alignment. It also works when we've got knee cap pain or patellar pain. Jumper's knee, runner's knee can also happen on the lateral side. Sometimes we need a sleeve that helps just keep things warmer, keeps things in more alignment, and kind of remind your body, hey, I've got something going on here. We can also talk about the strong, true medial unloader or lateral unloader braces, and that will gap that knee, keep it open here. The pressure goes from the outside to the inside, and that gaps the knee this way so that there's time for this meniscus to repair. Particularly if we talk about using your own cells. Imagine if we injected platelet-rich plasma into the medial meniscus, into the joint, and then let you go on your way without really addressing an unloading of it. Then with every step, we're just kind of putting pressure, putting force does not allow time for healing, time for rest. When we do ultimately all of these things, my goal is then that we've had you eating anti-inflammatory, we've reduced the inflammation, your blood markers have reduced, you're sleeping well, your stress is reduced, you've strengthened the muscles, we've made the ligaments and tendons nice and supple, the muscles are supple, you've got good flexibility. Then we harness your own cells. Platelet-rich plasma, bone marrow aspirate concentrate, or even adipose can be used, depending on you, depending on your history, depending on what is best for you. So we often use a combination of those. We harness your cells, we expertly put them in using ultrasound and or fluoroscopy guidance. The targets, it can be the joint, but not just the joint. We also target whatever else is injury. For example, if you have arthritis that is wearing down the cartilage, then we may need to go into the bone. If you have a meniscus tear, if you have a ACL tear, if you have a collateral ligament strain, those are targets. We also want to make sure that the ligaments are strong. We can use prolotherapy, dextrose in a 17% solution to the ligaments. We might need to address the patellar tendon. So all of this is not in a vacuum. We work together. This is not just a one and done. We work together for several months to make sure that we help bring you back to the activities you love. If you're interested in the Knee Boost system, which is this holistic approach, please visit kneeboostnow.com or comment below, ask any questions, and we are so happy to help you get the best knees in 2025. If you have knee pain and would like to learn more, I have a worksheet called 5 Things to Do Now to Reduce Your Knee Pain Within a Week. Go to www.kneeboostnow.com to download it for free. I'd love to hear from you, so please like, subscribe, and comment below so I can help you get out of your knee pain.